It's allergy season, and I'm a pharmacist, and I'm working on fixing myself. We'll start with Dr. Cunningham. Prior to 2020, providers like physical therapists, occupational therapists, speech language pathologists, they weren't authorized to provide telehealth care to Medicare patients. The expanded Telehealth Access Act that I introduced with Rep. Cheryl Blunt Rochester and other members addresses this issue and allows PTs, OTs, and others to permanently provide telehealth services in Medicare. And my question is, what would you consider to be the potential benefit of continuing telehealth flexibilities for providers that have traditionally provided hands-on in-clinic care, and what's the private sector doing with regards to these providers?
Thank you so much for the question. Actually, we just launched a telephysical therapy program at Providence, and part of the reason we did that is because we did not have enough brick and mortar facilities to accommodate the need, and we don't have, it's very capital intensive to build these types of facilities out. And we've had a tremendous experience with this program. We're planning to scale it across the organization. It's a collaboration between our on-site physical therapists and a vendor that we work with that provides the telephysical therapy in the home for the patients. We've been able to demonstrate really great outcomes with these patients, and in fact, a lower utilization rate in the sense that typically in-person visits and episodes for telephysical therapy are 6 on average per episode, and we're experiencing 3.4 per episode for our telephysical therapy program. So actually a potential reduction in cost is what we may be realizing over time. So I think there's a lot of exciting work happening in this space and a lot of great potential.
Well, good. Good thing I introduced that bill. Mr. Riccardi, I've heard from constituents and see more and more news stories that facility fees have been a challenge for patients and that patient coinsurance can be pricey. And my question to you is, what are your thoughts about facility fees, and should we prohibit facility fees for telehealth?
Thank you for that question. Cost sharing is a major issue that we also hear on our helpline. Sometimes our beneficiaries are confused as to why they're being charged a copay or multiple copays, or why one visit results in an additional visit. So I think first we need to have clear notification to beneficiaries about the cost of telehealth. And I look to the agency to consider the rates that are paid for telehealth in comparison to in-person visits. There are costs associated with telehealth, of course, and there are other costs associated with in-person.
Yeah, exactly. I'll go back to Dr. Cunningham. We've learned many important lessons and the central role telehealth has played. I'm a big advocate for that. It's almost a year after the official end of the public health emergency, and we're continuing to look at these lessons learned and how providers, patients utilize telehealth and virtual care. We know that more than 8 million Medicare fee-for-service beneficiaries had at least one telehealth visit. So how can these telehealth visits be used to reduce unnecessary emergency room visits and bolster preventative care services? Is my question.
Yeah, so I mean, we have some really great examples. For example, we have a remote patient monitoring program that specifically targets congestive heart failure, hypertension, and diabetic patients. Yeah. We've had so many great catches that we never would have caught if we hadn't had this program deployed, where the patients would have ended up hospitalized. We've seen a 3x increase in guideline-directed medical therapy for our congestive heart failure patients, which is associated with a 70% reduction in mortality. So, I mean, the impact is significant. We have early signals for reduced EMS calls and reduced ED visits and readmissions in this patient population. So huge promise as we scale this program out.
That's amazing. You know, I represent a very rural district in East Tennessee, and we're a border district. I mean, I touch Virginia, Kentucky, North Carolina. And when you have the flexibility to practice across state lines, it's huge. You know, and I'm also co-chair of the Congressional Bipartisan Rural Health Caucus, because with a member on the other side from Hawaii, you know, we have the same issues all across the country. And a lot of members like me are particularly focused on how virtual healthcare can fill the gaps in care for rural health and underserved communities. And I feel that telehealth can be used to address the shortage of medical professionals in rural areas. I mean, for goodness sakes, I'm a pharmacist, so we'd love to have provider status. But is there another way that Congress can encourage more telehealth usage among rural providers, specifically in smaller independent practices that have fewer resources and larger systems?
I would go back to some of the comments that Dr. Schwam and I have made, which is when there's uncertainty in the reimbursement model, where you're kicking the can down the road 1 year, the next year, there's a hesitancy, especially from these smaller practices, to really kind of go all in because there's an investment involved in making that transition.
Yeah.
And so they need to have that reassurance that reimbursement is going to be stable so that they can make the investment in making those transitions.
I got you.
Practice models.
I appreciate it. I'm over my time, so with that, I yield back, Mr. Chairman.
Generally yields back.